My mother's lived here for 7 years, and she loves it. In fact, they've helped to keep her alive. She would not be alive today if it weren't for them. They're exceptional. And it's a place for people that are older, that need care, and there's a lot of facilities that aren't this good. And so I just want to put that out that first and foremost. My mom loved to give roses to each one of the mothers in this place, including the staff members every Mother's Day. She loved to make sure that they got Christmas gifts too, and so she brought gloves and different things to all the team members. And my mother, I got a phone call this morning that she passed at 3:30 in the morning. So I am the person. She wasn't sick. She'd been really well. As far as we knew, she wasn't sick. So I was surprised, and the nurse that called me was exceptional. Again, if anybody could have called me to tell me this, I can't imagine it being any better. So I really want to emphasize that. I think this is such a bigger picture. I think it's tragic that they didn't have the support here to do the work that needed to be done in a good way. And I think that it's a larger issue with CDC, it's a larger issue with Mike Pence, it's a larger issue to take this seriously. And it's concerning now. How are we going to get these people out of here? If people are ill and even when they're asymptomatic, how do we get back to that? Anyways, so I want to say that this is tragic. I am so sorry for everybody involved. And I'm so sorry for us as a country, as a world. And we have to get on top of this. My mother would not like that I'm here today because she loves this place and wouldn't want to rock any boat. And I wouldn't be here if it weren't for her passing and realizing that this is so much bigger. This has got to get some support. And that doesn't mean that Life Care is doing anything wrong. I did get a phone call this morning at 10 a.m. from one of the people who now helps to call families every day and give them updates. And so, unfortunately, she told me that she's just updating me that my mother's fine. She doesn't have any symptoms. Her temperature's good. And she just is going ahead to update me. She'll update me every day. And I said, and what is your name? And she told me her name. And I said, that's my mother died at 3:30 this morning. And she was shocked and regretful. And apparently the nurse that had called me, she was swamped. She was giving meds, she was doing temperatures, she was trying to deal with the coroner and everybody else to help get my mom out, and she somehow neglected to get all the information in the chart. So that's tragic, and I also have great compassion for her humanity. I've worked in healthcare. It's hard, and this is even harder. So please have some compassion for their humanity, also while asking that we get some support in a bigger way for all of this. I'm going to stop talking. Thanks. She didn't have any symptoms as far as I'm aware. Oh, one more thing. I'm asking and lobbying to make sure she gets tested. I want her body tested. And I've been told, well, we don't do that. We just have to assume that it's natural causes. And so I'm saying it's not okay. I need to have her tested for the larger picture, for everybody involved. As a society, we're learning more about this illness all the time. We need to know. And so I'm told now that the health department is considering that. I still haven't heard back. Natural causes. No. And I said, well, we need to know if she's positive of this. They said, well, even if it's positive, it's a virus, so it's still natural causes.
When was the last time you spoke
With them?
Your mom.
My mom. Last time I saw her was last Sunday, before the quarantine, and we talked daily a couple times, and she called me on Saturday, we spoke, and I asked how she was doing. She didn't really understand what was going on. She just thought it was another quarantine for respiratory flu. And then I said, has your nurse talked with you about what this is? And she says, well, I know it's a flu kind of thing, but this happens. And then Sunday we spoke, and she was really depressed. And I said, how are you doing? She says, I'm depressed. I can't get out of my room. She has 2 roommates. One of them was coughing. And she says, most importantly, I don't know when I'm going to get to see you again. And then I called on Monday and couldn't get through. And I called Tuesday morning and I asked, will you please let my mom know that I'm trying to get through to her? And could you see if you can get a landline to her so that I can talk to her, have her call me? And so the nurse was doing meds, and I get it. So she got back to me a couple hours later, and that's fine. But she wasn't able to get the phone to her. And then I called at 8 o'clock, and they said, oh, we just put her to bed. She's sleeping now. I said, okay, I'll call her tomorrow. Well, it's too late now. Anyways, so compassion for all involved, and we've got to get serious on this. And thank you.
Vice President Pence is in town, today, and I know.
Vice President Pence is in town today?
Or in the state of Washington.
Really?
Yeah.
Wow.
As when you say that this is a bigger picture, if he was standing right here in his federal team, what would you say and what would you ask that you need?
I would say we've got to get on top of this. We have to take a bigger picture. This is bigger now than the virus. This is how do we contain this? How do we deal with people that are ill? How do we protect ourselves? But also utilizing the resources that we have worldwide, we've got to come together as a community and look at best practices for people that are living in facilities like this. We've got to learn from somewhere. Somebody's done this before. And I don't know, with him, I would just say, this is tragic.
Between the families here, I mean, you're finding community in one of the worst ways imaginable.
Yeah.
What are the conversations like that you all have with each other?
Well, I think some people are angry and frustrated, and I get that. And I have been more, well, let's have compassion for their humanity and all, and let's recognize that the healthcare workers have got a different experience going on, and they're also feeling beaten down, I'm sure. These are lovely people. And getting them the support. Actually, I got to go back to one thing that's really important to me. If you can get this on. One thing that would be most important to my mom in terms of a memorial would be to have us celebrate the workers here. So I'm moving to see if we can get that done. To bring gum, because she always go buy them packs of gum. To bring celebration for them. And also I talked to Beecher Hunter, who's the president of Life Care Center of America. He called me about an hour ago and said he said, oh, I am so sorry for your loss, and we made a mistake. And, what happened with the nurse, and I said, my hope is that there's some systems that will be in place to prevent this from happening again to any other family. And he says, you can bet there is after this. And then he asked me to talk with him about my mother. So again, I appreciate the call, but what I told him is that what's most important to my mom is that we have this gathering to celebrate these people here that work so hard. And he said that he'll make sure that we have that. So I appreciate that.